Now let us come to the other aspect of burning in urine. So many a times we see a lot of middle-aged and elderly ladies who constantly complain of pain in the bladder, pain at the urine passage, and then all the tests which they would have got at every place would have been normal. And there is nothing unusual in this. This is to be labeled as chronic pelvic pain syndrome. And once we look at that this is a chronic pelvic pain syndrome, we need to do an appropriate test, diagnose, and then treat them. The treatment initially would be with tablets, and it would take about 3 to 6 months for it to stabilize. And if they don't work, we may have to do a Botox injection. And if that doesn't work, we sometimes have to do a sacral neuromodulation or blocking the nerves around the bladder. We will now go to the next part of the thing where we see middle-aged and elderly ladies who have extreme urgency, frequency, and they have difficulty in controlling urine. And this is a very common problem seen in almost 30% of the ladies. The reason why it is most commonly seen in ladies is because they tend to hold urine for a very long time right from their childhood. It's been because of the social constraints they would have that it's nothing to be blamed. And slowly over a period of time, because of their anatomy, there would be some amount of recurrent infections which are not over. So the bladders become overactive and they would not be able to hold urine. And the moment they get a sensation, they have to run. Sometimes when they start getting up, or essentially if there is a pressure on the abdomen which gets translated to the pressure onto the bladder, they tend to leak. So what this does is that there is a social discomfort. They are not going around every place. But what I would like to say is they should not sit down at home and think that it is an aging process, and it can be very comfortably treated. Most of the times, in about 60 to 70% of people, we would be able to treat them with medications, but the duration of medication would be around 6 months to a year. But people who have been very uncomfortable, who have not responded to medications, there is an injection called Botox, which we tend to give it inside the bladder under the cystoscopic guidance or looking into the bladder at different places. What this does is it decreases the sensitivity of the bladder and then relaxes the bladder and allows them to pass urine comfortably with their control. The other only thing we need to look at is, are there any side effects of the treatment of Botox? There are no permanent side effects of treatment of Botox. In about 10% of the people who get a Botox, they may not be able to pass urine properly for about a week or two, which would automatically become normal. Now the next question is it one-time treatment or it's multiple treatments? Most of the time, in about 90% of these ladies, it is a one-time treatment in life. For about out of the 10%, 9% of them would need a second dose. The 1% may not respond to Botox, would need different modalities of treatment. But what I would primarily like to tell you all is, don't live with the disease. This is eminently treatable, easily correctable, and you can have a very normal lifestyle in future. Thank you.
Like, comment, and subscribe for more health updates.